You think you know your cholesterol numbers, right? We're all taught to watch them. But what if I told you the standard test you get could be missing a huge hidden risk factor, a really big one? So, what are we talking about here? Well, imagine a risk factor for heart disease that's super common. And it's not about what you eat or how much you exercise, it's almost entirely genetic. For decades, this thing has been lurking in the shadows, completely off the radar for most people. Well, today, we're going to drag it right out into the light. All right, let's give this hidden player a name. It's called lipoprotein A, or for short, you'll hear it called ELP, little a. Now, for a long time, this was kind of just a thing for researchers to ponder. But now? Oh, now it is front and center in heart health. So let's dig in and figure out what exactly this stuff is. Okay, so think of it this way. You've definitely heard of LDL, the so-called bad cholesterol. LPA is kind of like an LDL particle, but it comes with a twist. It has this extra super sticky protein attached to it, like a troublesome sidecar. And that little addition, it's not so little. It is a total game changer. And here's exactly why it's such a big deal. This is what we call the double threat. So just like LDL, it's atherogenic. Fancy word, but it just means it helps build up that nasty plaque in your arteries. But, and this is the key, that extra sticky protein also makes it prothrombotic, meaning it actually encourages blood clots to form. So you've got plaque buildup and a higher risk of clots. It's a real nasty one-two punch. I love this analogy from the American Heart Association. Picture your bloodstream as a busy river. The cholesterol particles are like little boats floating along. Now, most boats just cruise on by, but these LPA particles, they're like boats covered in Velcro. They don't just float, they get snagged on the riverbanks, your artery walls, and start piling up, making the whole river narrower and narrower. So you might be thinking, okay, sounds bad, but this must be pretty rare, right? Wrong. And you really need to understand this part. We are not talking about some obscure or one-in-a-million condition. The sheer scale of this is, well, it's mind-boggling. Get this, 1 out of every 5 people on the planet has high LPA. Just think about that for a second. That's a massive number. We're talking about 1.5 billion people. And here's the kicker. The vast, vast majority of them don't even know it. So, how do you get a high level? Is it your diet? Is it your exercise routine? Nope. For the most part, it's your genes. Up to 90% of your LPA level is just baked into your DNA. And that's what makes it so different from regular LDL cholesterol, where, your lifestyle can make a huge difference. And you can see why this has been so frustrating for everyone, right? For doctors, for patients, because your level is pretty much fixed by the time you're a little kid around age 5. And it basically just ignores all the usual advice. Eat better, exercise more. That stuff is great for you, for sure, but it barely nudges your LPA level. It's been a really tough nut to crack. Okay, so if it's genetic and you can't really change it with lifestyle, what's the point? What can you possibly do? Well, that's where the story starts to change. The medical community is waking up to this, and fast. And the very first step, the most important thing you can do today, is simply to find out if you have it. You've got to know your number. And just check out how quickly things are moving. A few years ago, back in 2018, the advice was basically, maybe test a few high-risk people. Fast forward to today, and major groups in both Europe and the US are saying, nope, everyone should get tested at least once in their life. That is a massive shift in thinking in a very short amount of time. The momentum here is undeniable. Now, even with that call for universal testing, there's some folks who should be running, not walking, to talk to their doctor about this. Does heart disease run in your family, especially at a young age? That's a huge red flag. Do you know someone who keeps having heart attacks or needing stents, even though their LDL cholesterol looks perfect on paper? That's another major clue that LPA could be the hidden culprit. All right, this is super important, so let's be crystal clear. As of right now, there isn't a specific approved drug just to lower LPA. So the current game plan is what you might call a holding action. It means if you find out your LPA is high, you can't lower it directly, but you can go to war on everything else. You get hyper-aggressive about managing every single other risk factor you can control. Your blood pressure, your LDL, your blood sugar. You nail all of those to the floor to lower your overall risk. But that's the strategy for today, and I'm emphasizing today for a reason, because the entire story around LPA is about to change. We're shifting from a story about a risk you're stuck with to a story about a stunning scientific breakthrough. The future isn't far away. It's practically knocking at the door. And you don't have to take my word for it, just look at these numbers. Right now, the best available treatments might knock LPA down by, say, 25%. It's something, but it's not a lot. But the new drugs being tested, we're talking about reductions of more than 90%. Let me say that again, over 90%. That's not just a little better, folks. That is a complete paradigm shift. It's a revolution. So here are the game changers you're going to start hearing about. Names like pelacarsen and olpasiran. There's even an oral pill in the works called muvalaplin. These aren't your typical cholesterol drugs. They're using incredible cutting-edge science, things like RNA interference to get these results. We're talking about treatments that can basically make LPA vanish from your bloodstream. So how on earth do they do that? Well, instead of trying to clean up the mess in the river, they go straight to the boat factory. These drugs use a really clever trick. They send a message like a molecular stop sign directly to the liver. This message blocks the genetic instructions for building the LPA particle. So your body, it just stops making it. It's like turning off the faucet instead of mopping the floor. Okay, wow. So we started with this hidden genetic risk that you couldn't do anything about, and now we're on the verge of a revolutionary treatment. Let's pull all this information together. What does this actually mean for you right now? Let's make a simple action plan. It really boils down to 3 simple steps. Step 1, be a detective. Dig into your family's health history. Early heart attacks, unexplained strokes, those are your clues. Step 2, take those clues to your doctor and have a conversation. You need to be the one to ask, should I get an LPA blood test? And step 3, and this is for everyone, control what you can control. Get relentless about managing your blood pressure, your LDL, all the known risks. That is your best defense today. And all of this leaves us with a really profound question. For more than half a century, high LPA has just been bad genetic luck, an unchangeable fact. But now that we can easily test for it, and with these incredibly powerful new drugs right around the corner, could we actually be seeing the beginning of the end for one of the most common genetic heart risks known to man? It's an incredible thing to think about.